everyone. I'm Megan McGurman.
And I'm Jason Tokarski. Welcome to another episode of For the Love of Health, brought to you by ChristianaCare.
According to the 2020 U.S. Census, the U.S. population aged 65 and over grew nearly 5 times faster than the total population over the 100 years from 1920 to 2020.
As the population ages, more people are worried about aging in place and being safe, well, and independent in their own homes.
Since 1922, ChristianaCare HomeHealth has helped neighbors in Delaware live independently and get the care they need. Here to tell us more are Ann Painter, president of ChristianaCare HomeHealth, and Pam Szczerba, director of quality education and risk management for ChristianaCare HomeHealth. Ann and Pam, thank you both so much for your time today.
Oh, we're really happy to be here and happy to share everything about home health.
Yep, thanks for having us.
Let's dive right into home health from the national level. What does the national landscape look like in this field?
I was just at a conference, and there was a lot of discussion around people want to receive their care in their own home, their health care, as much as possible. And we're seeing a tremendous shift to delivering more care in the home.
What would make someone eligible for care in the home?
There are many reasons, but some of the most common things that we see is patients who are in the hospital and after their discharge who need a little extra help at home after surgery, patients who are going to their doctor and have a change in their medical condition and have new medications and maybe need some education on those and how to take them and manage the side effects.
It's driven a lot by the services that we provide. We have skilled nurses that go out. We also have all the rehab professionals involved in our team. We have physical therapists, occupational therapists, speech-language pathologists. We have our medical social workers who also provide service to these patients and home health aid services. And as Ann mentioned, it is primarily patients coming out of the hospital, but local physicians will notice changes in patients and refer directly from their practices. We get patients that come from skilled nursing facilities as well as rehab units for their services as well.
I also just add in, patients who are having a fall or a near fall, those are great times to come and have a home health evaluation, especially a near fall.
We mentioned that ChristianaCare has been offering home health services since 1922, over 100 years, which we understand neither of you were around back then. But can you walk us through some of the changes that you know about that have started since the home health organization was initiated here with ChristianaCare?
When the home health agency was started over 100 years ago, it was mostly a focus on infants as far as caring for infants and newborns, as well as vaccinations and infection prevention like tuberculosis and syphilis, things that we don't talk a lot about today out in the public. But today, it has changed drastically. We see really complex patients at home, people who have had heart surgery who are coming home in 2 and 3 days. We have patients that are coming to us that have ventilators, they're on respirators, they're getting infusions, things that 10 years ago we wouldn't have done in the home. So it's a little bit different than it was back then.
Mm-hmm. Some of the other differences I can see is I've been a part of the home health program. I'm almost at my 27-year mark. And, I look back to when I was out in the field as a physical therapist, and it has changed so much. As you've seen, length of stays shorten, and the needs of the patients have increased so much. One of the other changes that's very obvious is the technology. I remember it was the days of carrying the papers. I would have to log my hours. I had to drive into the office to bring my papers in. And now we are just blessed to have wonderful technology. In our home health services now, we use an iPad. Our clinicians can access the medical record through that. They have their phone as well. And it makes it a lot more efficient and easy to work with.
ChristianaCare Home Health is certainly a robust program. What sets you apart regionally and nationally?
In the state of Delaware, we have over 350 caregivers who serve all of our patients statewide.
We serve from the top to the bottom of the state. Currently, our active daily census is 1,500 patients in the state of Delaware.
We admit about almost 10,000 patients every year across the state. We spend a lot of time focusing on quality of care. We have a lot of education and training that our clinicians receive. We also have our therapists, our really tenured. They've been with us more than 10 or 15 years. So they're highly experienced in preventing falls in the home, redesigning the home to age in place.
The staff out in the field are amazing. And Ann has said that. We, even when we've had surveyors are in, they really make note of how experienced our clinicians are, and they really know the home care environment. That's something that has sort of shown, I think, here within the health system. When issues come up, we're now talking with other parts of the healthcare system that are visiting into the home. They're like, oh, maybe we should talk to home health. They've been out doing this a long time. And even about falls program, like, what have you been doing? And it's great to interact with our other partners that go out to the home for other reasons and to share our experiences. So I think it is just the skill level of the people that are out there caring. And we do have a really strong leadership program that works, our education team. Quality is so important to us. We're Joint Commission accredited. We're in a deemed status. And I think that it just really stands out.
We also work very closely with physicians and providers. So we're actually, our medical record is integrated across to the health system. So providers have very easy access to what we did in the home. We have very easy access to our providers via an internal text messaging system. So I really think that sets us apart, where we can really get a hold of the provider quickly, have a quick conversation about what we're seeing in the home, and have the provider guide us on what would be the best next steps for that person to keep them at home and make sure that they continue to get healthy.
You mentioned your team is helping people age in place. Are they moving furniture and helping kind of redesign houses to help people who may be in a wheelchair or something like that?
Yeah, that's a really great question. So occupational therapist is an exceptional expertise in going into the home, looking at how the home is set up, and can make suggestions as far as just even think about moving a wheelchair through a doorway. Sometimes the doorway might be a little narrow, but just taking the door itself off the hinges allows a wheelchair to fit through a bathroom door. Critically important for all of us. So that's how we're making aging in place possible.
You start assessing the situation the minute you get out of your car, right? Like, as I get out of my car and I'm approaching the house, I'm looking at the sidewalk or the path into the house, and my mind is already starting to go and start to think about the needs of this patient. And then, like Ann said, you're scanning the minute you're in the house. I mean, it's just, that's a part of what happens and what you're doing. And so, yes, it is really about making the patient as safe as they can in their home. And I think that that's what we've been hearing. Patients want to be in their home, right? The care in the home is where it's going. And we've been doing that, and that's what we've always believed. I've always believed I want to figure out how to have the patients gain their strength and mobility in the setting that they're in, right? Like, that is really where their day-to-day activities happen. I want them to be safe. I want them to be stronger, more mobile, and look at what their environment is and work with that.
Yeah, I think the other thing, too, to just add in is medications. We learn a lot when we go into a patient's home because sometimes they've received new medications, they have instructions, they have older medications in the home, and really making sure that we take a look at that together because sometimes what you take over the counter can actually interact with the medications your doctor ordered. So that's really important for aging in place because it could make you lightheaded and that can make you fall. So another great area for home health to focus on. Mm-hmm.
You mentioned earlier how technology has really made your job a lot easier. What other kinds of innovations have you been working with that are really working to provide care that is beyond the typical, beyond the expected of what is coming from home health?
Yeah, it's exciting to talk about the innovation work that we've been doing in home health. I think it really jump-started when, in 2018, one of our members of our team, Denise Woods, who's the rehab manager, won the Innovation Challenge. And that was part of the work with the Health and Technology Innovation Center at ChristianaCare. And that really connected us with that part of the system. And we worked on her project, which involved the Alexa device. It was a really unique skill. It was the first HIPAA compliant skill skill, so it was within the program. We were really looking at creating a tool that was very centered around the patient's goals. What is it that is the patient's goal of care? And then developing reminders and daily cues and just helping the patient to be aware of their plan of care for the home care team. So that work is actually continuing. We're looking hopefully to get into like a phase 2 of that work. So it is the future. It really is figuring out how do we engage these types of tools in the home care setting to help us with our plans of care. And it has moved into our most recent exciting work that we're doing, which is introducing consumer robotic into the home care setting.
And the robotic study has been incredibly interesting. We've had 5 patients that have utilized the device in a study, and we're just getting ready to hopefully be able to release those results in the next couple of months.
By adding in these types of use of technology, our hope is that it could reduce the caregiver burden. And when I say caregiver, I mean our nurses and our therapists out there. Like, what is it about that innovative tool that could help reduce maybe the volume of paperwork or just the amount of time we'd have to be with a patient? Like, is there things that can be supplemented through that innovation? So that's some of the things that we're exploring right now and learning from and growing.
There's plenty that we've talked about that already seems very forward-facing with the technology and what your plans are. What do you see as the future for home health?
For the future of home health, we're going to see more care delivered in the home than what we have going on today. I think we will see shorter lengths of stay in our hospitals, and more of that post-surgery stay will actually take place in the home environment, and that's where patients want to receive their care. I also see that there will be less use of skilled nursing facilities and inpatient rehab facilities, and more of that care will be delivered in the home. I think one of the things that we're definitely going to see is, in the hospitals, how if we go back 20 years ago, primary care providers actually rounded in hospitals. And today, there are hospitalists, acute care physicians that actually do that so the primary care providers can see their patients. And I believe that we will actually see, I'll call them homist for now, homist providers who will actually be the attending provider while the patient is receiving home health services, which 10 years, maybe 5 years from now, will be more like acute care services that we see today in our hospital, but there will be homist providers who will actually oversee that care. And then, as the patient gets better, they will hand it back off to the primary care provider like we see in a hospital today. That's what I see, and so we're going to see a lot more acute care services delivered in the home.
Have there been any patient stories that really stick with you about the importance of your work?
Our social worker in the wintertime actually went out to see a client. She had called ahead of time to schedule the visit. The patient needed some help with some special equipment as well as with getting medications. They had some financial troubles. And so the social worker had planned this whole visit out, went to the house, went to the front door. The TV was obviously on, the lights in the house were on, but no one came to answer the door. She called, no one answered the phone. Some people might have just walked away, but not our social worker. She went around to the back of the house to kind of look and see what was going on, and the patient, unfortunately, was face down in the snow. And she called and activated 911, and because of her, that patient was recovered actually in the hospital. Our clinicians make a difference in our patients' lives, but they always go that extra step when something doesn't seem quite right to make sure that we can meet the needs of our patients.
It's amazing. Ann and Pam, thank you both so much for your time.
Oh, thanks so much for having us. It was great talking with you.
Thank you very much.
And we'll have more information on ChristianaCare Home Health in the show notes for this episode.
And don't forget to subscribe to For the Love of Health on Apple Podcasts or Spotify, and follow ChristianaCare on social media.
We'll be back in 2 weeks with another great conversation.
Until then, thanks again for joining us
For the Love of Health.